From the branches of the subclavian, this is probably the internal thoracic artery, which goes down to the chest, if we say. Or ignore that actually. Alright, this is the inferior thyroid branch. We said above we have the superior thyroid branch from the external carotid, and this one is the inferior thyroid from the subclavian. As for the face, this is the facial artery, anastomosing with the supratrochlear and the supraorbital arteries, where it ends. As for the nerves of the face, this nerve inside the orbital cavity is the maxillary nerve. As you know, the maxillary nerve enters the orbital cavity through the inferior orbital fissure, as you see here. Then it re-enters a groove, which is the infraorbital groove and canal leading to the infraorbital foramen. So it emerges. The end of the maxillary artery is the infraorbital, maxillary nerve is the infraorbital nerve. It emerges on the face and supplies this area. Other branches, this one is the supraorbital, the more lateral one, and the more medial one is the supratrochlear, and below it we have the infratrochlear. Much below that, this is the external nasal. This emerges between the nasal bone and the cartilage. So you can see this part of the nerve, this is external nasal, it is different from this one. This is the infratrochlear. Okay. If we go to the inner section, this is the nasal septum, the perpendicular plate of the ethmoid, or the vertical plate. This is the vomer below it. This is the septal cartilage. Okay. Then, of course, we have the paranasal sinuses. This is the frontal sinus. This is the sphenoid sinus. The ethmoid sinus lies in this region. It's not obvious here. And the other one is the maxillary sinus. Maybe it's obvious in the other one. It lies here, deep to this structure. Alright. Then you have the oral cavity. The nasal cavity is more obvious than the other one. The septum hides it here. The oral cavity, of course, you know, we have the tongue. The tongue here, we can see the intrinsic muscles of the tongue. Beginning with these are the topmost. They are the longitudinal muscles. These are the vertical muscles. The transverse muscles are, go in this plane. So it's like in the same plane of the horizontal, but the direction is different. So this is the longitudinal, the transverse, and the vertical. The muscles below them are extrinsic. We already saw these, the mylohyoid, the geniohyoid, and the genioglossus. This is the genioglossus. Okay? The hyoglossus lies outside of it. We have to see it on the other side. The lingual tonsils are located in this area. These are the lingual tonsils. Okay? This is the palate. You can see they are distinguished by the hard palate, which is formed by the palatine process of the maxilla.